5 days in and many of the queues have gone, but not for the reason needed by a fuel-thirsty nation. Where there is still petrol and or diesel, it's easy to spot. The worst, though, is now over, says the government.
We now are starting to see the situation improve. We're hearing from industry that supplies are coming back onto the forecourts in the normal way. And I would just really urge everybody to just go about their business in the normal way and fill up in the normal way when you really need it, and you know, things will start to improve.
About 16 petrol stations later, we're at the front of the queue.
That was Lizzie late last night. This is her this morning, finally able to leave Brighton for a shift in Sheffield as an acute medicine staff nurse.
So we managed to get an Uber yesterday morning to a petrol station to fill up the jerry can, to then fill up the car to be able to drive to a petrol station that we found out was being refilled with petrol.
Lizzie's hope the Prime Minister's right and things are normalising, because after using her fuel to drive for 4 hours home, she'll still need to get to work.
So that would be about a 2-hour walk to work each day for 12-hour shifts. So yeah, I was slightly panicking. Yeah.
Umar finished a 48-hour shift in the Midlands yesterday, drove home to London where his wife is a GP, but with only one tank of fuel between them, they had to decide who worked today.
I'm a children's heart doctor, so I look after children's hearts, and that's what I'm training to do. I'm a senior registrar, and I'm towards the end of my training, so this is my crucial time. I really want to be at work, you know. I don't want to be at home. There was stuff that I could do at home and think, okay, well, I can utilize my time very well here, and there are stuff that I can do. However, I spend most of the day looking for fuel. So I've achieved nothing, not going to work, not doing anything productive at home, still really no far better, and still worrying about the end of the week. And that's not just me, you know, I'm sure there's plenty of other key workers and do very important jobs. And I don't think this is us as doctors saying we should have priority or anything like that. But, you know, if it's me happening in my team, I'm sure there'll be other people later on, and across all the different teams, across all different hospitals, across the country. That's going to have a major impact on the NHS.
These signs, for people over a certain age, have a familiar feel. Same empty forecourts, same deployment of the forces. 150 tanker drivers have been made available this time round, but the reasons are different. Back in 2000, it was blockades at refineries over proposed tax increases. Now, it's a shortage of drivers to drive the fuel. But what of the political impact? How damaging was that for Tony Blair's government?
Well, it was very damaging in the short term. It was one of the few times that Labour actually fell behind the Conservatives in the polls. But of course, come 2001, just a year later, Tony Blair won a massive landslide. I think there is an underlying concern about competence around Boris Johnson in the way that perhaps there wasn't for Tony Blair in that period. And if there are repeated sort of decisions and a sense from the public that actually the government isn't in control, particularly on these cost of living issues coming up, then you could actually see this turn into something a bit more of a longer term problem for the Conservatives. But if voters don't feel that Labour has got any answer, then it's not going to matter.
The Prime Minister today said no special measures will be put in place for key workers. His hope, the panic buying may now be over, so normal behaviour will then resume. And while that's the hope for some, for those we all desperately rely on, it's a need.
Well, we're joined now by Jane Townsend. She's Chief Executive of the UK Home Care Association, whose members provide assistance and support to people in their own homes. Jane Townsend, thank you for joining us. Is this fuel crisis, so far as you're aware, continuing to put lives at risk?
Our members have continued to struggle today. Some have managed to fill up, but many others are still stuck in queues, waiting on forecourts, and having to drive miles to find sources of fuel so they can carry on with essential visits.
Can you tell what sort of scale that's on? I mean, is it worse than it was the day before, or is it a continuum?
Well, we're now into nearly the 5th day of this, and our point really is that a plan should have been in place last Friday when problems became apparent. We shouldn't have to spend 4 days trying to argue for help it's not the kind of thing that you can solve locally on your own. We need a national coordinated effort. And there are plans in place, but local resilience forums weren't able to invoke them because government declared that there wasn't an issue. So the kind of solutions that might have been put in place, such as making fuel pumps available for key workers between, say, 6 and 7 in the morning, vouchers for essential workers, so retail staff would know who was eligible, simple things nobody has been able to do. And it's just created a huge amount of stress on top of stresses that already existed because of workforce shortages and the pandemic.
You obviously have quite an important perspective. Boris Johnson has suggested key workers such as carers will not get priority fuel. What do you say to that?
I would say that that is indicative of this government's attitude to older and disabled people and to our care workforce. The much touted social care reforms do little for them. In fact, they'll probably end up with lower take-home pay as a result of national insurance increases. So yes, you know, that is the whole issue, that there isn't sufficient concern for the health and well-being of our older and disabled people.
Shortage of workers has widened from the HGV lorry drivers and now includes care workers. What is the scale of shortage in the care sector? Do you know?
Well, Skills for Care estimate about 112,000 vacancies. It's difficult to be precise with home care because we're seeing a rise in demand, increasing numbers of older and disabled people with multiple long-term conditions. And we are not even coming close to meeting need. Councils are reporting large numbers of people turning to them for help and they're not able to give it. NHS hospitals are packed to the rafters. They're struggling to deal with their waiting lists and they're struggling to discharge older people back home because there is insufficient capacity in the community.
But can I just sorry to interrupt you, but can I just ask you, I mean, the government has allowed, you know, special visas for drivers to come in and help on the long distance trucking. Would it make a difference? Would it make an impact if a similar deal was done for care workers from abroad?
It would certainly help because particularly London and the southeast, and also there's an indirect effect. So the tourism industry down in counties like Devon is directly targeting recruitment of care workers because they know that they're good with people and well trained. And that's because the tourism industry, for example, hasn't been able to access workers from overseas as in previous years.
Well, Jane Townsend, thank you very, very much for joining us. Thank you. Kathy.
Well, here at the Labour Party conference in Brighton, the fuel crisis is the talk of the town, if not always the conference hall. In a minute, we'll hear more from the Labour leader. But first, I'm joined by the Conservative leader of Somerset Council, David Fothergill, who also chairs the Local Government Association's Community Wellbeing Board. David Fothergill, you might have heard Jane Townsend there saying that the government's shown insufficient concern for the elderly and disabled people during this crisis and, you know, therefore essential workers should be prioritised for fuel. Do you share that concern?
Well, I have a concern about the whole sector, which is under enormous pressure at the moment. Clearly, as we've come through the pandemic, the impact upon our services is that we've got to see an increase of some 30% on our domiciliary care. So there is a huge pressure in here. And you overlay that with things like COVID vaccinations, where we have significant numbers of people who aren't actually vaccinated twice and therefore are having to stand down from the roles. And now we've got disruption to people getting to work. So actually, this is a real concern for us. We want to make sure that everybody can get to work. But you know, we're talking about people here who do some very basic jobs for people like your mother, my mother, your relations, my relations. They turn up at people's houses and they do jobs that many people would not want to do. And they're finding that more and more difficult because they can't access the fuel to get there. It's just another stress that they just don't need and just don't deserve.
So therefore, would you urge the Prime Minister to prioritise those essential workers for fuel?
Well, we've always said that we need to make sure that they do get the fuel to get to work, and locally a lot of councils have worked with their local retailers to try to bring forward schemes. We can't actually trigger a national scheme. That needs to be triggered by government. The word that we're getting on the street at the moment is The word that we're getting on the street at the moment is that the situation is improving. But if it hasn't improved in the next 24 hours visibly, then I think it should happen, yes.
I mean, do you have confidence that the government's planned for this properly? Because I know you warned in 2018 that the government needed to help councils plan for a no-deal Brexit. Have they planned for the fallout of Brexit, which is one of the reasons for this driver shortage?
So in our local resilience forums, which is how the civil contingencies are handled locally, we will have done all the planning for this, and all the councils will have worked with their LRFs to make sure that there are plans in place. They exist. We know where our main petrol retailers are. We know which ones we can allocate as emergency supplies and to essential workers. We have all those plans in place. So all the work has been done. We just need that to be triggered. But at the moment, without that being triggered, we have to work at a very local level to make sure we can get these people to work and do some really essential jobs.
Do you think the Prime Minister's boosterism has sort of got the better of him here, and actually he should trigger that plan, as you say, within the next 24 hours? But should it have been done yesterday?
Well, I think that we're seeing that petrol and diesel is now becoming through the system, and certainly locally I'm seeing an uplift in petrol stations which are open and a reduction in those queues. But if that's not maintained, and we are seeing similar issues by tomorrow night coming into the weekend, then that does need triggering, and that's absolutely when I'll be calling for it.
But isn't it ridiculous that there were queues in the first place in Britain in the 21st century?
Absolutely ridiculous. And what's ridiculous as well is that people have been driven by different motives to queue up for hours to fill small jerry cans, or even still people filling bottles of water bottles with petrol and diesel. It is absolutely ridiculous. People need to know that they should queue for the fuel when they actually need the fuel, and they should be very considerate of essential workers. We've got a lot. We saw during the pandemic that essential workers are people that keep this country moving, and that's not only the NHS, but it's also care workers, and it's retail workers, and it's the blue light services. We need to make sure that those people do get to work, just as they did in the pandemic, and that's why we need to prioritise them.
David Fothergill, thanks very much for joining us.